So let's start our next case, which is ectopic posterior pituitary gland. Usually, ectopic posterior pituitary gland is associated with absent pituitary stalk or infundibulum. Okay, so normally the posterior pituitary gland shows high signal on the unenhanced T1 weighted image. Okay, but this high signal should be seen at the region of the pituitary fossa. If seen at the expected location of the apex of the pituitary stalk, okay, this means that there is no pituitary stalk and the posterior pituitary is migrated at its apex to be connected with the hypothalamus. Okay, so in this patient, the posterior pituitary is functioning and secretes the posterior pituitary hormones. Okay, so the hypopituitarism here is limited to the anterior pituitary hormones. Okay, not to the posterior pituitary hormones. Okay, because we are going to discuss the another case of hypopituitarism, where the patient will complain of decreased anterior and posterior pituitary hormone levels and function. Why? Because the patient will have absent pituitary gland. Not in this case. This patient here has absent pituitary stalk. That's why the posterior pituitary is ectopic and the anterior pituitary is not connected to the hypothalamus. So the posterior pituitary is functioning. However, the anterior pituitary hormones is not connected to the hypothalamus. So the pituitary, there is hypopituitarism limited to the anterior pituitary hormones. Okay. Because normally the pituitary gland function is controlled by the hypothalamus, and the pituitary stalk is connecting the nerve fibers coming from the pituitary gland to the hypothalamus. Okay, so as you can see here, this is ectopic posterior pituitary gland. Okay, and absent pituitary stalk or infundibulum. That's all for this case.